Jackson Lee for 5 minutes.
Thank you very much, Mr. Chairman, and thank you, Mr. Secretary. It's a pleasure to be in the room with you. And let me acknowledge that America has a great deal to be thankful for this administration and under your leadership. You were an early appointee, and we're delighted that people are living because we took hold of the reins and had a no-nonsense plan to ensure all Americans, and I want to emphasize in particular, impoverished and uninsured Americans as well. In the state of Texas, we are literally the poster child for uninsured. We're the poster child for the poor handling of COVID in the early stages. We have upwards of some 90,000 cases and maybe 50,000 dead. And we continue to have the issue of low vaccination rates in different portions of our state. We somewhat fell victim to no masks, fights about masks, and other destructive elements that certainly were not positive. So I want to just go right to the heart. The administration put forward a very positive and effective COVID package that would include impoverished being able to be covered or the uninsured, as well as to make sure that there would be dollars for those who may be coming in petitioning for asylum, and making sure that those individuals might be vaccinated. In addition, we were very much concerned about the international aspect of a very small world. Can you tell me what medical health impact a skinny COVID has? We certainly want to move forward on a COVID bill, but what do we leave out and what danger do we face?
Congresswoman, we disclose how we utilize the resources we get. What it simply means is that we will be back sooner than you think, saying we're here again, we're depleted in our resources, and we need to finish the job. And so I will simply say to you that we're going to use whatever resources you give us the best we can to keep COVID at bay. And I hope that we don't let our guard down and have some future variant come back and just squeeze us the way it did back in 2020.
One of the issues that we all face is mental health and substance disorder. You have put a sizable amount in the president's budget or in your budget. Tell me what you're doing agency-wide to ensure the parity between physical and mental health. My colleague just spoke about the dangers, the damages. I would add that one of the most dangerous calls are domestic violence calls for police officers, but in the mix of that is someone having a mental health crisis.
So, Congressman, I don't think there's any other way to say it, but that the president's budget is a game changer. It takes mental health services and the approach to tackling mental health conditions to a different level. When you are willing to commit not only discretionary but mandatory dollars to the degree the president has, so that we can help states attack the crisis that we see in our communities on mental health. I hope what Congress will do is accept the challenge and help us, because there are people crying out today for help. We're getting ready to launch the 988 three-digit code that will be available for people to call, similar to 911. The 988 will be for those who are suffering severe mental stress and who are on the verge of doing something that they will regret. We want to make sure that when that system goes live nationwide, that if someone is going to take the time to make the decision to call us instead of going the wrong decision, that they get an answer, not be put on hold or get a busy signal.
And let me just quickly indicate, I would hope, as you well know, we have those community public health clinics around America. I'd like to see us dedicate some totally to mental health services. And I hope as we continue, we'll have an opportunity to discuss that. Let me just quickly say, let me thank you for the emphasis on child care, Head Start, the block grants, and you might comment on how important that is coming out of the pandemic. As I do that, let me ask unanimous consent to put into the record an article dealing with White House Burdens Initiative to address long-term COVID-19, and then an article about UMC, a hospital in Houston.
Without objection.
Thank you. I would like to raise the UMC hospital and just ask that I get a report back on that issue and to see whether there's any reconsideration. But I'd appreciate your comment on the mental health, and then thank you for what occurred in the CMS settlement that gave us a lifeline until September regarding the Medicaid. I'd like to continue working with you on how we can solve that 1115 problem. But could you just comment very briefly on the child care that you all have invested in here that I congratulate you on? Thank you.
Yeah, and I'll be brief because I know time has expired. I'll simply say this, Congresswoman. I remember the days when the talk was every parent should, if you're going to have a child, start thinking about how you're going to invest now for your child's college education. So start putting away money now so you can afford the tuition of your child. Well, today, Americans are being told not only to save for that college tuition for your child, but be ready because by the age of 1 or 2, whenever you start childcare, you're essentially spending college tuition level amounts to get basic childcare for your 2 or 3-year-old. That's incredibly difficult for any family that's middle class or below. We need to do something to make childcare affordable. We have a very productive workforce. We don't want people leaving the workforce because they can't find quality childcare. We also have to treat those people who work in childcare as human beings, as professionals, pay them the salary so they don't go off and decide to go flip burgers because they can get more money doing that.
Chairman, thank you.
Gentlewoman's time has expired.